Okay, we are going to go ahead and get started for our week 6 call. So I'm not going to waste any time and let's do this week. Okay, so this week we're going to talk about how you inject a chin. So this is not something that we talked about in training. So I'm going to teach you how to do it on this call. It's a very easy procedure, but it's just one additional tool that you can add to your tool belt. We are also going to talk about end of the month. So these are the different things that you have to do at the end of every single month. We are only at the 12th of the month, but there is a graphic that we're going to post for you. That way it makes it super easy for you to know exactly how you close out your charts and how you close out your end of the month. And then we're also going to go over stock transfers. And then finally, the homework for this week is you're going to join a new Facebook group and you're going to post 2 times on social media. This time it's going to be before and after for chin Botox or chin toxin. And then you're also going to do the average price of neurotoxin. Again, I have these graphics for you, so they will be posted tomorrow morning. All right, let's get started on the chin talks.
Okay. Good morning, I'm Dr. Tim Joshin and welcome to Best of Both Worlds, or Bob W. Today we're here with Katrina, who's one of our consultants, and we also have Brittany, our medical assistant. So today we're going to be talking about what I used to refer to as golf ball chin, and I've been informed that the name has been actually changed to cellulite chin, and some people will also call it orange peel chin. And then there's this other term that's being thrown around, which is chin augmentation. Now, a chin augmentation has nothing to do with what we're going to be doing today. A chin augmentation is actually where you put a prosthetic device underneath the skin to make it enhance it. So today we're talking about cellulite chin, and the reason Katrina is here today is because when she talks, she makes this puckering look on her chin. And she's got such a perfect face. And when I said to her, Katrina, we need to work on your cellulite chin, she was a little bit taken aback. But a lot of people don't know that they're doing it because you don't see it when you look in a mirror, because people do things to make themselves look their best. And one of the things you do naturally is you relax your chin muscles. So this is not cellulite. This is not orange peel. This is actually muscle fibers that are attached directly to the chin. And when you make different facial expressions, they pucker or pull in. Now we have a really easy treatment, and that treatment is to do one of the neurotoxins, either Botox or Dysport. And today what we're going to be using is Dysport because I like it. It's a simple treatment, and you're going to see just how easy this is. What we do is we take a little alcohol just to clean off the chin, and then what we do is we just take the tiniest amount of Dysport here, and we have a little vibrator to try to make it a little less painful. And then we go right into the midline, excuse me, Garrett, and we put it in all the way down, and then we inject. And boom, it's all done. Now, Katrina's going to start to see a result in about 2 to 3 days. It does take a maximum of 2 weeks for the optimal onset of this product. The side effects are really minimal with this. They include bruising, swelling, and also a little bit of a crooked smile. And so that's very unusual. In the many years I've been doing this, I don't want to say how many, but it's over 10. I've only ever seen a crooked smile 2 times. So make sure you're going to somebody who has experience doing this, because it's an easy treatment and it really can make a huge difference in your face. And what the difference is going to be is you don't have the pucker, and it makes your jawline look smoother and more youthful. So thank you for tuning into Best of Both Worlds. If you have any questions, you can always contact us at contourderm.com.
Alrighty, so he went over just a real quick introduction of how you actually do the actual procedure. So it's important to know, when you look at the anatomy of the chin, of how the muscles actually fire. So I'm going to pull up this quick graphic for you, and you can see the muscle actually bifurcates. Okay, so whenever you are treating a chin, some people will do 2 injections on either side. So they'll do 1 on the right side and then 1 on the left. So they'll try to not hit the bifurcation. They'll just try to treat it independently. The issue that I have seen in the past with this is that sometimes people will do a little bit more, a little bit less, or their muscle might be stronger on one side than the other. So what I have found personally, and obviously the injector that y'all just watched, he does it very similarly. I do one injection right in the center of the belly of the muscle, and I treat it as a large muscle group. So I literally do 10 fluid units right in the center, go all the way down to the hub, 10 fluid units, and then be done with it. Some injectors, they'll bifurcate that and they'll do 5 on one side and 5 on the other if they're using Dysport. Obviously, if you're using Botox or Jeuveau, you would go and you would chart 5 = 2. So you'd chart 2 and 2. Dysport I like a lot because especially if I'm doing that one injection point, has a little bit more spread than the other neurotoxins. So it really does give a beautiful overall aesthetic appearance once it kicks in about 14 days. So again, I just treat it as a large muscle group, go right down to the center, 10 fluid units and be done with it. Again, you can always bifurcate it. Any questions of how you do this procedure? Excellent, pretty easy. All right, moving on. So this is what can happen if you don't treat the full muscle. So when we see this is if an injector has not bifurcated that muscle perfectly enough, one side of the muscle will still be active and will jet out. So it literally looks like a bean is kind of sitting in their chin whenever they kind of make that facial expression. So if you do kind of do in the center, it does tend to minimize this. So just kind of be aware of that. All right, so let's talk about stock transfers. So stock transfers occur for one of two reasons. The first one is when you are initially requesting product from Stephanie or from our inventory coordinator. So whenever you go into Bamboo and you fill out that entire Google form to request product, Stephanie will then go and she will actually send you the product. Now, the second part of that is you go into aesthetic record and you go into inventory and you go into stock transfer. So I'm going to show you what that looks like real fast. So you have to log into aesthetic record through the actual website. So not through the app. Okay. And you go ahead and you can log in. Not a robot. So this is the web browser version. All right, so I'm in Texas. You will not see this. You will only see what is available to you. So you are going to go into, you're going to click into inventory at the very top, and you can go all the way down to stock transfers. So it's on the bottom left. Now, these are the stock transfers, and you will see if it's in transit. In transit means that Stephanie has put it in for you, and you have to go in and accept it. Okay, so you can see it went from stock inventory to Danae, or you can also have it go in between 2 injectors. So let me see if I can find one between 2 injectors. So here we go. So the first one that I said you would just go in that Stephanie has sent it to you. The second one, so this particular one is between Medina and Jordan. So Medina had some extra neurotoxin that she needed to offload and Jordan accepted it. So they did a stock transfer in between the 2 of them. She has to go in and actually accept that. So how she does that is I'm going to click one that is stock transfer. You're going to hit details. And you're going to go all the way down here. And this is what the inventory coordinator has sent Danae. So she sent 200 units of Botox, 600 units of Dysport, 300 of Jeuveau, and then she sent 6 B12 as well. Once she does that, she will hit confirm and accept once she has it in her possession. So that means that the FedEx guy has delivered it, or the UPS guy has delivered it, or if you are in the Houston area, Stephanie has delivered it to your front door. So we want to make sure that that product actually delivered to you. That puts it into your electronic stock. So it's really important that you complete your stock transfers so the product will move seamlessly through the company. Any questions on how you do a stock transfer? Excellent. Pretty easy to do. All right, moving forward. Okay, at the very end of the month, so today it is only November 12th, but at the end of the month, this is the graphic that is going to kind of be your Bible. So you're going to go through this at the end of every single month. you're going to go through and make sure all of your charts are closed out. You want to make sure that your traceability is done, that your notes are in, that all of your points are correct, that you've completed all of the transactions. You also want to make sure that you have signed your charts. And I'll talk about this a little bit next week as well. You want to make sure that your bank drop is complete. Again, we'll talk about this later in the month. And then you obviously want to check your inventory as well. You want to make sure that your stock numbers are everywhere where they should be, that your product is still good. So it's always just good just to do a visual check of all the product that you have. But this is going to be your Bible for the end of the month. And in here, I tell you exactly kind of how to do this. So if you want to close your charts out, you're going to follow this graphic. If you want to sign your charts, you're going to sign your charts. Your bank drop kind of walks you through this process. Again, it's super easy to do. All of this is going to be done. You can do everything on the web browser and not the app. That's the easiest place to close out your charts, is going to be on the web browser. All right, so for this week, you are going to join. So last week I had said you were going to join, I believe it was a networking group. This week, super simple. It's just going to be a Facebook group. Okay, so a little bit less stressful. So no, I know Kaylee, you said you were sick last week. So this week you kind of get a buy, you get to join a Facebook group. And you're going to post a before and after of some chin Botox. I will post that graphic for you tomorrow morning. And then you're going to develop one education post about the average cost of neurotoxin. I already have this graphic for you as well, so you can grab it and post it. So both of those graphics will be posted for you. Your Facebook post will, your Facebook group that you're going to join, that is your homework. And then obviously you want to continue your social media following. These are the 3 people that I recommend that you start to follow. They're really great. Just like always, they post a lot of education things. They do a lot of before and after. You want to continue to add to your tool belt as far as an aesthetic injector, learning anything and everything that you can get a hold of. Act like a sponge, because that's going to make you the best injector. All right. Well, that is this week. Nice and short and sweet. I'm going to stop recording.